Let me thank Kathy very much for her gracious introduction, and she delivered it just as I wrote it for her, so no, I'm just kidding. Very gracious of you, and I thank you for it. And more importantly, I thank you for your ad. I've been at 8 events today, so I'm going to try to use the microphone before my voice leaves. So I appreciate your work and all of the federally qualified health centers in our state, because what it is about is changing people's lives and be able to give and fulfill their God-given potential in terms of their health and their ability to perform. And so I really appreciate what Kathy does in her advocacy, not just here in New Jersey, but across the country. I'm thrilled to be here with your new mayor and a dear friend who I've worked with in empowering people, Mayor Kelly. I think you were talking about some men see things the way they are and ask why. I dream things that never were and ask why not. So it is a beautiful idea. And I knew what you were saying every step of the way. And it is a symbol of your type of thinking, Mayor. So it's great to be here with the members of the council, as well as our county officials. Freeholder Magazine is tireless. If I were to describe an animal to him, I'd call him a bulldog. Once he bites into you, he doesn't let go. And he was in my office when I was a member of the House of Representatives and representing a district all the way up north. And he kept coming, and I said, Lou, I do not represent Cumberland County. And there's only a limited number of empowerment zones to be had, you know? And he said, yeah, but someday. And so anyhow, he was a soothsayer, and so anyhow, he got my support, and Cumberland got its empowerment zone. And he's just a tremendous advocate, along with Freeholder Denone and Freeholder Thompson and Surrogate Ranieri. I have to call him a judge now, so it's good to be with all of you and Assemblywoman Riley as well. I wanted to be here, and I appreciate your distinguished CEO, who I know Gil gets away with saying things that some of us cannot. I appreciate it a great deal, though more importantly, his love of people and making a difference in people's lives. In my mind, today we celebrate far more than opening a new health facility and the only primary care site in the area, but we celebrate a great community effort. One that turned a building that was once a school and then, as you said, a clinic into a vital new state-of-the-art community health center that will benefit everyone. Because community health centers are generally all takers. It means whoever walks through the door, whether you have insurance or don't have insurance, gets treated. It took everyone working together to make it happen, everyone from the private and public sector working in a partnership for community progress. And I think that's something the mayor clearly knows that what I'm talking about. It's his election slogan, progress through partnership. And this is a perfect example of that type of partnership, of getting things done through people. That's how we move forward. Local communities and organizations like Community Healthcare, working in partnership with the federal government, have provided a helping hand with the Recovery Act, funding capital improvements of $1.7 million for 3 projects, including almost $800,000 for this one alone. And that's what it means to invest in our communities and in our future. You know, I was looking at the sign there that is the national symbol whenever we have the Recovery Act. It says, building for the people of the United States of America. That's you and me. It's building for our families and for our future. And if anyone is wondering if the Recovery Act is working, I urge them to look at what's happening here. It's an investment in Bridgeton. It turns something that now turns into a state-of-the-art community health center. It puts people to work to help have it renovated and to make it available for the type of healing that goes on today. And it will give people access to the kind of affordable health care that Community Healthcare Inc. has provided New Jersey residents since 1976. But in my mind, it is really far more than even the building, more than the jobs, more than an investment of money. It is about the lives that we will touch. The mothers that come in, maybe pregnant with a child. It is the children who are at the beginning of their life, at the dawn of their life. It is about some of our seniors who may be looking at the twilight of their life. It is about all of the elements of our society and how we want to ensure that every individual has the ability to get quality health care. That's what Community Health Caring has been doing for quite some time. That's what's going to be able to continue to do to this great facility. One of the things that I appreciate so much is the work that you do, not only here, but throughout the state and throughout the country. And so, as a member of the Senate Finance Committee, when we were in the midst of the battle over health care reform, and we were talking about creating a new exchange of private companies that will have to compete under federal guidelines for all those millions of Americans, including 1.5 million New Jerseyans who have no health care coverage whatsoever and go to sleep every night wondering, can I have a facility like this to go to, or do I have a facility to go to? That in fact, we would ensure that the legislation that the President signed into law because of my amendment requires private insurers to fully reimburse federally qualified health centers in the exchange. Now, federally qualified health centers, which are a primary health care option for millions, will not lose revenue that they essentially need to ensure new patients gaining coverage. So now, someone who, when the law goes fully into effect, says, I want to get access to the exchange, but I still want to come here to get my primary health care, well, that insurance company is going to have to pay this center the same as they pay anyone else, and that's going to keep this center alive and keep it open for future generations of people. I'm also thrilled that as part of our advocacy, the new health care reform legislation that the President signed into law puts $11 billion in new funding over 5 years to help health centers expand their operational capacity to serve nearly 20 million new patients nationwide. And of the $11 billion, $9.5 billion will fund new health centers for communities in need and expand capacity at existing health centers. The remaining $1.5 billion will allow health centers to modernize aging buildings and build new ones to serve even more patients. And the new law includes $1.5 billion over 5 years for a national health service corps that will place an estimated 15,000 primary health care providers where they're needed the most, in communities that are often underserved. That's, in essence, what the new law will do. And I also see some of my friends who are seniors here, and I am so upset listening to the opponents of the law suggest that somehow the law undermines Medicare. The law enhances Medicare. It extends the life of Medicare, and it provides a whole new series of preventive services for seniors that they did not have fully paid for. And so Medicare is strengthened under the law, not weakened. And so what we do at the end of the day is say that no New Jerseyan, no American should ever go to sleep at night worried that they cannot afford to be ill because they are one paycheck away from bankruptcy, one incident away, one illness away from facing catastrophic consequences in their lives. No one in the greatest country on the face of the earth can face that challenge. And that is in essence what the law will change dramatically as we move forward. So I'm proud that the Recovery Act is funding an institution that is going to change people's lives for the better. I'm proud that there is a new health care law that says in the greatest land on the face of the earth that no American goes to sleep at night worried about their health care. And I believe that through those partnerships we can have a better tomorrow. Thank you very much for having me.